IAHPC thanks the Chair for the floor and welcomes this session on the way forward. Frankly, the world can't go much further backwards in terms of how the vast majority of health systems have treated older persons and neglected their palliative care needs. We were deeply disappointed by the lack of member state participation in the discussions this past week, given the enormous suffering older persons and their loved ones have undergone during the pandemic. One Vatican official called what has happened the massacre of the elderly. Yet populations have no way to hold their governments accountable for this crime. Our deliberations this past week were haunted by the spirits of all the older persons who lost their lives in great suffering this past year. We should have taken a few moments to mark their passing collectively. But since we didn't, let's harness the energy of that vast well of disenfranchised grief and suffering. Let's ensure it was not in vain. Let's redeem and dedicate it by drafting an authoritative, binding convention that protects the rights of all aging populations everywhere, so my grandchildren will not have to endure what so many of my generation and older did, with no effective cover for their human vulnerability at the most challenging time. Palliative care, like human rights, is rooted in the dignity of the human person. Its aim is to alleviate serious health-related suffering, such as that associated with most chronic conditions and infectious diseases. Had it been mainstreamed through health systems, as we have advocated for many years, much of the suffering we witnessed and are still witnessing would have been avoided. It wasn't, though, because aging, like palliative care, illness, and dying, are stigmatized and subjected to magical, medicalized, wish-it-away thinking. This working group has developed a fresh, destigmatizing narrative that prizes universal communities of rights holders of all ages, one that must be made visible and legible in a binding convention that celebrates every last one of us. The multilateral system has clearly failed older persons. That will not stop global civil society from leading the way to a binding convention, and we thank the multilateral system for giving us the space to convene and find that out for ourselves as we lead the way forward towards this binding convention. I thank you.